You're watching Newsfeed AM. Let's pick up on this now. The Minister of Health, Dr. Joe Phaahla, speaking at a high-level universal health coverage seminar under the theme, Build the World We Want, a Healthy Future for All, says the Portfolio Committee on Health in the National Assembly has made significant progress to process the National Health Insurance Bill. This is after their work was paused due to the COVID-19 crisis. Let's get more now on what exactly is the progress on this bill, and we speak to the Deputy Director General at the Department of Health, that's Dr. Nicholas Crisp. Doc, thank you very much for your time. Let's talk about that progress around the NHI Bill. Just how much progress has been made?
Yeah, good morning and good morning to the viewers. Pleasure to be with you. So we have a long process of lawmaking in South Africa, and as you indicated in the introductory comments, it was a little disrupted by what was going on during COVID when Parliament wasn't able to convene, and then they finally got virtual meetings going. The process has now got to the point where all the consultation had taken place. That means the consultation in communities, the consultation in the portfolio committee itself, then there were some written submissions, some oral submissions, and then what's called the clause by clause. Now that clause by clause is where the members of the portfolio committee discuss the implications of the wording within the clauses, and then at the end of that process, the National Department of Health had a chance on the 30th of November to respond, which we did. We made some recommendations of changes to wording of several of the clauses. Now what happens is the Chief State Law Advisor will make what they call the A list of amendments to the bill. It goes to a vote in the National Assembly, from where it will go to the National Council of Provinces.
Yeah.
So we anticipate that because Parliament is now out, that will all happen in the early part of next year. And before the end of 2023, we expect that the bill will come back to the joint houses for a vote before it can become law.
All right. And for South Africans who are wondering, again, this is a constant reminder that we need to put out there. The NHI simply is about universal coverage for all the people of South Africa who may need medical care at whatever point in their lives. And so what about affordability? Where do we stand on that?
Yeah, so let's remind ourselves, universal health coverage is a global program that was started by the United Nations, where we are a signatory, and our head of state is a signatory to the agreement on the universal health coverage. We had just had on the 12th the International Universal Health Coverage Day, where we had guests from Geneva at the World Health Organization and our own office speaking about the global move towards universal health coverage. What we are trying to achieve is that we all get the health care that we need when we need it, where we need it, at an appropriate quality without incurring financial hardship. Now, we responded to lots of financial questions during that seminar, and I'll cover the highlights of that now. We spend 8.5% of our gross domestic product on health in South Africa. That is very high for a country in our position in the global economic standards. But we don't get the output and the outcomes that we should be getting. In other words, we are getting poorer health outcomes in terms of death and morbidity statistics than we should for the amount of money we put in. And that is largely because we have the most inequitable health system in the world, barring perhaps the United States, which we were reminded is a very bad example to follow, and the only other country that is not following universal health coverage. So we have just on half, 49% of our expenditure is currently in the public sector and 51% in the private sector. And what that means is that the resources that are available to everyone in South Africa are being systematically drawn into caring for a small portion of the population, estimated somewhere between 15 and 20% of the population. And what we are trying to do with NHI is to get all of that money, the pool of that money, all into one common arrangement, which we call a single payer system, managed by a fund, so that everybody gets the health care they need. And the implications for us as people who live in the country is we won't need medical aids anymore, unless we want to cover ourselves for things that are not covered by the fund, which systematically will become fewer and fewer what we call benefits or services.
Yeah.
So this 556 billion rand we currently spend is enough to do a lot more than we currently do. And that's the focus for now. And we must not be sidetracked by whether we need additional money. We don't need additional money. We need to spend what we've got better.
Okay. You saying that people will not need medical aid anymore, but that doesn't suggest by any stretch of the imagination that the private healthcare institutions are going to shut down. So those who still want to have medical aid on the side, they could still have that, is it?
No. So what the fund is intending to do, and what the bill says very clearly, is that the fund will purchase healthcare from both public and private providers. So we will still have government hospitals run by the provinces. We will still have non-government organizations running various establishments like many of them do now. And we will still have private providers, that includes hospital groups, general practitioners, pharmacists, and all manner of private providers who will continue to run their businesses. But instead of having our healthcare purchased from them by medical schemes, our healthcare will be purchased by the National Health Insurance Fund. And it will be instead of having to try and choose a scheme and a package and guess what is going to be wrong with you in the next 12 months, you will now, every one of us will be covered for the same things, and the fund will pay for it. Now, moving the money out of the public service, where it is currently allocated through what we call the appropriation bill and through the Treasury and parliamentary process, is an easier process. It still takes a number of years to do it, but it's a little bit easier. The second half is how do we move what is currently voluntary contributions in the private sector into the same funding arrangement. And that also happens slowly over time with different tax instruments to do it. And that's where the debate is. If you are paying an increased tax, but you'd never have to pay for a medical aid because all your benefits are covered by the fund, then we should all be happy that that is what is happening. The provision of healthcare is a different matter entirely. And as long as those service providers are accredited with the fund will then buy from them. It just means that we will see a mix of people who are presently public and private purchasers of healthcare or users of healthcare having our services purchased from the same set of resources.
Yeah. How do you build confidence then, Dr. Crisp, around the public healthcare system? And I'm saying this...
Yeah, we've got a lot of work. Yes.
And I'm saying this on the back of exactly the crisis or the pandemic we faced, in that it exposed a lot of these weaknesses. How do you convince someone who is on a medical scheme and goes to a private medical institution for health care because they're saying, I can't go to a public institution where I'm going in with a sore head and I get a leg amputated?
Well, that's a bit of an exaggeration, but thank you very much. We've recently had an example in the private sector where a wrong knee was replaced. So it happens, and it should not happen, and these are things that we as the health professionals in the country need to be vigilant about. So we've got a lot of work to do as South Africans, as those of us who work in the public service, to improve the way in which services are delivered within the public sector. But our colleagues who work in the private sector know that they've got a lot of work to do to improve the way that they provide healthcare as well. There are decisions that are made that are influenced by money rather than by healthcare, and we know that it happens, and we have a lot of challenges to make sure that that's not the way we take decisions. So I don't, just picking on the public sector is not going to solve the problem. We do need to work to improve management, both of the money and the human resources and so on. But where we are sitting at the moment with an average spend of 5,200 Rand per person in the public sector per annum and 26,500 Rand per person in the private sector, You will never get equity, and you will never improve the public sector if that's what we are going to continue with. On average, we spend as a nation 9,000 rand per person per annum. But with these massive dichotomies of spending and resource allocation, you will not improve the quality. What the NHI will do in the early phases of implementation is start to dilute the public sector so that there are fewer patients, so that there's more space in which to work, to improve the quality and the way in which we manage the care there. And patients will have their health care purchased from private providers who have, in many places, excess capacity to look after them. This is not a one-year job or even a 2 or 5-year job. We've learned from what we've seen in many other countries that it takes a long time to do this. Yeah. You have to be diligent and not move too fast, otherwise we break systems that are working well around the country.
All right. Final question, Dr. Crisp. So you've gotten a number of people, I hope, excited that they are going to, at some point in the future, hopefully in the near future, access medical care without really needing to pay money up front. When does this bill become law?
Okay, so the bill becomes law when the lawmakers in Parliament vote on it and the President signs it into law. So we are hoping that will happen before the end of next year. As we said, it's still got to go through the National Council of Provinces and be consulted in the provincial legislatures, because it is what we call a Section 76 piece of legislation, referring to Section 76 of the Constitution, which requires that things that impact on provincial functions must be discussed with them as well. So once it becomes law, then the President proclaims clause by clause the implementation of that law. And there's provision in the last section of the bill, Section 59, for the President to bring these clauses into effect in a systematic manner that allows us to implement national health insurance. So you can imagine we need to implement a board, the various statutory committees, the policies and processes need to be rolled out and so on. Yeah. So that's what we are busy with at the moment in the department, designing those details so that once there is a law and a board, they can start to take over managing the implementation of the fund.
Dr. Nicholas Crisp, let me thank you very much for your time, Deputy Director General in the Department of Health.